All right, everybody. This is In Liberty and Health. Jesus, I can't even talk. In Liberty and Health, episode 13. I'm very excited to have my guest here, Dr. Philip Ovadia, a brand new author. His book actually came out today, November 11th, 2021. Stay off my operating table, and we're going to kind of dive into some of how we could stay off his operating table here in the podcast. So, how are you doing?
I'm doing great. Thanks for having me on, Kyle. Really excited to have this conversation with you and your audience.
Awesome. Well, we're all stoked to have you here. So, I guess kind of tell us your story and explain what got you into, staying off your own operating table and getting other people to do the same thing.
Sure thing. And my personal and professional stories certainly intertwine on this front. I've been a practicing heart surgeon now for over 15 years. I've done over 3,000 heart surgeries. And during much of that time, the first 10 years or so of my career, I was progressively unhealthy myself. I have a background of, being obese my entire childhood and, through my adulthood. And that was despite really following the mainstream advice around how to stay healthy. I was always very active as a child. My family ate, very much in line with the US dietary guidelines. I have a older brother who is a type 1 diabetic, so we didn't have sugar in the house. We ate, low fat food pyramid diet, margarine instead of butter and skim milk in our, whole wheat cereal every morning. And, I found myself at a crossroads about 10 years into my career. This is about 5 years ago, where I had tried, to lose weight many times. And I had some short-term successes, with all the standard stuff: eat less, move more, eat a low-fat diet. But, clearly it wasn't working for me. I was morbidly obese at that point. I was pre-diabetic, and I knew that I was going to end up on my own operating table, so to speak. And thankfully, about 5 years ago, I came across some alternative thoughts about, why we get obese, why we get unhealthy. My introduction was via Gary Taubes, the investigative journalist and author. He had written, at that time, I heard him speak at a medical meeting, and he had just written The Case Against Sugar. And prior to that, he wrote Why We Get Fat and Good Calories, Bad Calories. And I read his books, and they resonated with me, the message that the types of food we eat are more important than the amount of food we eat. And I implemented it for myself. I went on eliminated sugar and went on a low carb dietary strategy. I was able to lose over 100 pounds, maintain it for 5 years now. And more importantly, it got me curious as to why didn't I hear this in medical school? Why didn't I learn this as a practicing heart surgeon? And ultimately, what I came to realize is that, food, what we eat, is the primary determinant of our health. And that we've gotten that messaging around what we should be eating very wrong. And that has led me to my, kind of new secondary mission to help people to stay off my operating table by understanding these concepts around metabolic health.
Right. So, along with the low carb kind of diet, which I myself, I guess technically would follow, I get about 30% of my calories from carbohydrates. But I followed a carnivore diet for about 2 years, and we were always told everybody was always told that saturated fat and cholesterol is going to kill you. Eating all those fatty steaks, eating all this ground beef, eating all this bacon, this is going to make your LDL go through the roof, and then you're going to be scooping cholesterol out of your clogged arteries, and you're going to die when you're 35 years old. But it was kind of funny that they never questioned when I ate, a big salad with vegetable oil dressing and all this junk food, candy and stuff like that. But then as soon as I brought in some ground beef with a little bit of salt, now all of a sudden they're concerned about my health. But I lost 70 pounds. My digestion was better. I felt better. Everything was better. But according to them, my diet was going to kill me. It sounds so counterintuitive, but I think that's the experience for a lot of people. And it seems like you had a very similar experience as well.
Yeah, exactly. My dietary kind of journey ultimately led me to carnivore as well. I've been largely carnivore for the past 3 years. And as I mentioned, I improved every marker of my health
Mhm.
with the exception of LDL. And, again, this opened my eyes to the reality around LDL cholesterol. And, there's a lot of debate about the importance of LDL cholesterol in the development of heart disease. But ultimately, what I've come to recognize is that whether or not you accept the data that, LDL cholesterol is a risk factor for heart disease, and it's probably a minor risk factor. The reality is that metabolic health is a much more important risk factor. The data around LDL cholesterol, the best data we have, and I kind of put best data in parentheses there, shows that, having an elevated LDL cholesterol level puts you at about a 1.4 times risk of heart disease as someone who doesn't have an LDL, elevated LDL cholesterol level. But when you look at metabolic health, most commonly measured by insulin resistance, that puts you at about a 6 times risk of heart disease. So much bigger risk factor for heart disease. And metabolic health also puts you at risk for many forms of cancer, Alzheimer's disease, diabetes, high blood pressure, all of these things. When you look at the top causes of death every year in the United States, 6 out of the 10 of them are directly attributable to poor metabolic health. So no matter what you believe around cholesterol per se, metabolic health is clearly a more important marker for us to focus on. And that's sort of the central message of my book, that we need to be focused on metabolic health. And by doing so, that's going to help you prevent heart disease and most of the other chronic diseases that plague us. And ultimately, that's going to help you to stay off of my operating table.
Yeah, I completely agree. And it was kind of funny because I've heard a lot of people say that their LDL went a lot higher on a carnivore diet. Um, Even after about 2 years, I want to say my LDL cholesterol was actually on the high end of normal. I want to say it was around 155. So I know I think the standard range was like 80 to 140, if I recall correctly. You would know better than me. But
Yeah.
yeah, they say that you want to have your LDL cholesterol, I believe, around 80 to 140, but mine was 155. I felt fantastic. So I guess, could you perhaps elaborate a little bit more on the kind of studies around saturated fat and cholesterol? Because like I said, I'm of the belief, and I'm sure you are too, it's not the meat, it's what you're eating with the meat. When you put carbohydrates and ketchup and all this other stuff on top of meat, then it makes it way, 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 way more palatable and way easier to overconsume. But it's not just that burger patty that's causing the your obesity or insulin resistance. It's everything else on top of that.
Exactly. So, most of the data that we have tying saturated fat consumption, the amount of saturated fat that we eat, to negative outcomes of any sort, and heart disease is the primary area that's focused on. That data comes from what we call epidemiologic data. And what that means is that they go and they ask people what they eat, and then they look at their health outcomes and they try and tie those two together. And there's a couple of problems with doing that. Number one is people aren't very good at reporting what they eat.
Mhm.
Many of these studies ask them to think back, like over the past 6 months or a year, and say, on average, how much of this did you eat? But even the ones that track them in real time, like each day they're recording what they eat, people aren't good at judging amounts, and they're not very honest. They know sort of what is supposed to be healthy and will kind of skew what they report.
Mhm.
But even if we had very good data on tracking what we eat and the health outcomes, that still doesn't prove any relationship. It only suggests relationships.
Mhm.
And it turns out that most of this data, as bad as it is, doesn't even suggest that relationship between saturated fat and heart disease. And in fact, we can go back to the original seminal study that was used. It was called the 6-country study. It was done by a researcher named Ansel Keys. And what he did was he, you know, purported to graph the amount of saturated fat that was eaten on a macro level by countries and their incidence of heart disease, again, on a macro level. And he showed 6 countries and he showed this nice linear relationship lining up the two. The reality is that the data set that Ansel Keys looked at had 22 countries in it. And when you graph out all 22 countries, there is no relationship whatsoever. He handpicked the 6 countries because he was interested in, pushing this narrative that saturated fat was related to heart disease. So, that was the foundation this whole argument was based upon. Most of the science that came after it was flawed. A lot of it didn't even support the original conclusion. Yet here we are, 60 years later, still pushing this same narrative. And the problem is that when you take saturated fat out of the diet and you need to replace it with something, it largely gets replaced with processed carbohydrates and ultra processed foods and fake oils, these processed seed and vegetable oils. And as we've been doing that over the past 60 years, clearly the incidence of obesity, heart disease, diabetes, all of these things have been increasing. So there is no real logical way that you can look at this and say that, eliminating saturated fat is a good thing in our diet.
Yeah, I completely agree. As a person who once again went on a carnivore diet, um, one of the biggest things about going on a carnivore diet is increasing the amount of protein and fats that you have, because protein is so satiating. And not only that, the leucine content in red meat is what triggers muscle protein synthesis. So especially for people who are resistance training, it's so important to have red meat, which usually comes with saturated fat. Um, I could never understand this demonization around it, where people will say, oh, well, you need to have protein and protein's so important, but saturated fat's bad for you. Well, once again, one of the best sources of protein comes with saturated fat. You're going to be incredibly satiated after eating, specifically red meat. And not only that, as I said earlier, that has the right amount of leucine to trigger muscle protein synthesis. So you're going to grow. And what's your body's greatest sink for glucose or sugars? Muscle. So I don't understand why anybody would ever think it's a good idea to reduce the amount of red meat that they're taking in. It's, to me, a no-brainer to keep it in your diet because it's so satiating. It's delicious. I don't know anybody that, has a steak and says, I'll pass on this.
Yeah,
So,
exactly.
right.
I largely agree with that. And I largely go back to our evolution as humans.
Hmm.
Meat, animal products are clearly what we evolved eating. So to think
Hmm.
that somehow that all of a sudden in the past, 100 to 150 years became damaging to us is really a flawed concept. But I want to say importantly that, I don't think that carnivore is the only healthy diet to have. One of the sections of my book actually goes through most of the popular diets today, literally both vegan and carnivore, keto, Mediterranean, low carb in general, and talks about, what are metabolically healthy features of each of these and what are not metabolically healthy features of these. And ultimately, what I default to is any diet that is keeping you metabolically healthy or improving your metabolic health, I'm in favor of. And I do truly work with both vegans and carnivores. There are ways to do it. I tell people that doing it as a vegan is a lot harder. You have to supplement, or, it's just sort of a lot more complex than doing it as a carnivore. But ultimately, they're both possible. And I support any dietary strategy that's going to improve your metabolic health.
Right. And that's great to hear, specifically from somebody that's kind of been around the low carb community for a while, is that you're not dogmatic at all. You want results, you want health. And we know compliance to the science. Not everybody's going to sustain a carnivore diet lifestyle for a long period of time. Honestly, it wasn't that sustainable for me after 2 years. So I introduced some carbohydrates. I have protein bars, I have a lot of fruit now, I have a lot of sweet potatoes. But my most of my calories still come from fat and that of red meat. And some people may not thrive on that. Some people may thrive on a vegan diet. I think it's probably a smaller portion than people can thrive on carnivore, but obviously we probably won't have studies in our lifetime, at least, to say whether or not, whether or not there's specific populations or whoever can thrive on certain diets. But it's good to see that you're not dogmatic about diet, because there are some people who say, oh well, you have to go carnivore, you have to go vegan. Flexible dieting is the be all end all. When you create these hard lines around food and dietary approach, some people don't handle that well, because as soon as they get that piece of sugar, that piece of cheesecake, or maybe even for some vegans, that little piece of meat, then they just gorge. And we know that binge eating is not healthy either.
Exactly. My approach to it, again, in the book, is that I outline, 7 key principles of metabolic health. And I think, if you stay within these key principles, you are going to optimize your metabolic health. And, the one around food that I outline is to eat whole, real food. I think there's no getting around that. When
Right.
you look at, what do the vegan and the carnivore diet have in common? That they're based on eating whole, real food. And, again, these processed foods with these fake vegetable and seed oils and these highly processed carbohydrates have only been introduced into our food supply, recently, in the past 150 years or so. And clearly during that time, our health has worsened. So, you know, people argue a lot, or ask me a lot about, well, what is it? Is it the vegetable and seed oils? Is it the processed carbohydrates? Is it all carbohydrates? And my answer is, we really don't know, because the reality is that processed food always combines processed carbohydrates with vegetable and seed oils. So it's really hard to separate out one versus the other. But I go back again to our sort of evolutionary history, and one of the rules I sort of talk about around food is, if your great-grandparents, your grandparents 150 years ago weren't eating it, it's probably not something that we should be eating.
Right. And I think that's a great way to look at it. And, when you look at these dietary approaches, typically they restrict either carbohydrates or fat. When you have carbohydrates and fat together in low protein, it's very, 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 very easy to overconsume. Think about it. Cake, burgers, milkshakes, these all have highly processed carbohydrates and fats together, which just make it so easy to overconsume, and therefore make you metabolically unwell. So obviously we want people to buy your book, but kind of what are these 7 principles that you look for when addressing metabolic health?
Yeah, so the first principle, I think, is probably the most important. It's the overarching principle that you need to think of your health as a system, not as a goal. And what I mean by that is, we oftentimes focus on the short-term goals. I want to lose 20 pounds. And when you do that, one of 2 things typically happens. Either, you lose 20 pounds by, usually restricting something, and you get to your goal and you say, great, I lost the 20 pounds. I can't maintain this restrictive lifestyle, so I'm going to go back to what I was doing before. Or probably more commonly is, you don't lose the 20 pounds, because losing 20 pounds is kind of hard. And you then kind of give up and you get frustrated and you say, okay, I'm going to go back to what I was doing before. Instead, I would like people to reframe their thinking around their health being an overall system. I want to be metabolically healthy, and I'm going to find the habits that support that metabolic health. And I think that that is a more sustainable more sustainable way to think, and ultimately leads to the successes that you want. Because when you get metabolically healthy, you are going to get to that healthy weight. You'll lose the weight if you need to. You are going to avoid heart disease and the other chronic diseases, and you're going to stay off my operating table, another goal that people have. But the right approach isn't to focus necessarily on the goal. It's to look at your health as a system.
Okay.
Yeah. And then I was just going to say the other principles, end up largely being the habits that are going to support, your metabolic health. So it's eat real food, we already talked about. It's move more. I
Mhm.
don't say exercise, I just say move more.
Right.
It's sleep well, sleep enough is actually how I put it in the book. Reduce your stress and, you know, find, I say in the book, find a doctor who gets it. Basically meaning that, you need to find a partner in this journey. You need to find someone to
Mhm.
work with that understands this and is going to support your decisions. Far too often, as you relayed, you're going to make these changes and they're going to, have great effects and you're going to lose weight and, all of your lab work might look better, but that one metric, that LDL cholesterol is going to go up maybe. And, your doctor is going to say, this is killing you.
Mhm.
And, ultimately, when physicians do that, they're kind of not intentionally. I mean, they have good intentions. They just don't have the educational framework to really understand this concept of metabolic health, and therefore they end up, kind of working against the patients. And the last principle that I outline is basically to make one sustainable change at a time. And this again goes to that sort of success mindset. You know, if you try and change everything at once and it works, you're not going to know what part of it actually worked. And if it doesn't work, again, you're not going to know which of those changes, may have worked if you did them by themselves and which ones were working against you. So I do like the approach of kind of, picking one sustainable change at a time, focusing on one area and seeing what the results of that are. And if it works, if you're improving, then you add the next thing onto it. So I think, those 7 principles are going to be a framework for people to work within and to allow them to optimize their metabolic health.
Wow. Yeah, that's I think those are 7 principles that everybody should live by, especially people who are seeking to improve their health. And I specifically admire that you do not just say eat less, move more, because I see so many people in different weight loss and motivation groups. As soon as somebody says, well, I want to lose 20, 30 pounds, people just start saying caloric deficit, caloric deficit.
Right.
Uh, okay, that's fine. It's true, whatever you want to say. But nobody knows what that looks like. When you just tell
Yeah.
people eat less, move more, there's nothing actionable there, so it's not helpful. I had a
Yeah. That's
friend,
exactly it.
right, and it's very, very frustrating because people hear that and then they just say, well, the hell with it. I'm not even going to try because what can I do? I don't know what I'm doing. This person says caloric deficit, eat less, move more. Well, how am I supposed to move? What does moving more look like? What does eating less look like? I don't know. Nobody knows, so they like I said, they just give up and want to do something else instead. So, and I like that you said just move, because that's something that everybody can do. Everybody can get up and go for a walk, right? And so many people take the approach of, I got to do an hour of cardio every morning, I got to work out for 2 hours a day, and then before I go to bed I got to do 50 push-ups, and I got to make this huge change, when it's just, if you just do one small thing, that's probably going to get you a decent bit of the way there. And then, like you said, as soon as you make that one change, then implement the next. See how it goes. If that works and it works well, keep going. Maybe implement something else. If that doesn't work, take it out and then try something else.
Yeah. The problem, there are a couple of problems with the eat less, move more, kind of calorie in, calorie out concept.
Mm-hmm.
The first problem is that we're not good at measuring either side of that
Mm-hmm.
equation.
Absolutely.
We are not good at counting our calories. The food labels are oftentimes inaccurate, and
Mm-hmm.
we're not good at judging portion sizes and how much we're eating. And it turns out that the types of food you're eating are going to influence how much you eat. When you
Mm-hmm.
eat certain foods, they're going to make you more hungry. And, if you're just kind of trying to use willpower to restrict how much you eat, we know that that's not sustainable in the long term.
Mm-hmm.
And the other side of the equation, how many calories we burn, is also, something that we really can't know in real life. We can measure it in very controlled laboratory settings, but that's not how we exist. And again, the types of food that we eat are going to influence how many calories we're burning. Our body composition is going to influence it. There are so many factors that go into influencing how many calories we burn in a day that it's really unmeasurable. So while it's true that, yes, if you want to lose weight, you technically need to be taking in less energy than you're burning, it's not a useful concept to help people lose weight. And more importantly, I think it distracts from what should be our message, that we need to focus on the types of food we're eating and not the amounts of food we're eating. And it turns out that when you stick to eating whole, real food and you eliminate processed food from your diet, your body is able to properly sense how much food you need to eat. And most people, that's going to look like you're going to be hungry less often. And therefore, it becomes easier to eat less. Many people talk about intermittent fasting as a strategy for losing weight. And I do think fasting is a great tool for losing weight, but I don't think it should be a forced thing. I only end up eating once or twice a day because I eat nutritionally dense food and I'm only hungry once or twice a day. That's a lot different than eating a bunch of processed junk food and being hungry all the time, but just trying to restrict yourself to only, eating during a certain period of the day. That is hard to do. That is ultimately not sustainable. But another one of the things I tell people is find the types of food to eat that are going to make you hungry less often. And that is going to lead you to success.
Yeah, that's a great way to put it. So when you tell people to start moving, what kind of, do you just have people start walking? Do you tell people to, try to get an exercise? Because I'm all about trying to get people to just start,
Yep.
From 0 to 1 could be a very, very far distance, but 1 to 2 isn't as far as 0 to 1. And then
Exactly.
2 to 4, it's exponential. You get more and more potential as you get better and better. So, what are some of the incremental improvements that people can make to just, maybe lose a couple pounds that gets them to get that spark in their eye to want to keep going?
Yeah. So I think the key concepts around this are, just move more. Whatever you're doing, find ways to move more throughout your day. Because the mistake that I think too many people make is they say, okay, I'm going to go to the gym and I'm going to exercise for an hour, whatever that exercise is. And then they spend the rest of their day sitting around being inactive. And ultimately, that's not going to do you any good. But if you just find those opportunities to move more throughout the day, take the 10-minute walk after you eat or, in the evening before you go to bed. Take the stairs instead of the elevator or the escalator when you can. For me, I always, tell people when you can use a stand-up desk instead of sitting all day. And so, those are the useful concepts. And then when you are going to exercise, I think it's best to prioritize the activities that are going to build and maintain muscle. We have very good data that shows that the more muscle you're able to maintain as you age, not only the longer you live, but the higher quality, of the life that you live.
Your health span.
Yeah, exactly. Your health span and your lifespan both improve with maintaining muscle as we age. So, those can be simple body weight exercises, resistance exercise of any form. If you want to lift weights, great. If you want to use resistance bands, great. If you want to just do body weight exercises, things like push-ups and pull-ups and squats, that is adequate to do it. And you don't have to do a whole lot of that. 15 to 20 minutes, 4 to 5 times a week is going to be plenty of, muscle building and muscle maintaining activity. So, those are my general thoughts around exercise. And I guess the last important concept is, the saying that you can't out exercise a bad diet is true. First and foremost, if you're only going to make that one change, focus on what you're eating, the types of food that you're eating. And then, you can kind of worry about the activity part later. Because what I ultimately, in real life, what I find is that when people start eating well, they then are inclined to get more active. It just
Mhm.
happens naturally.
Right. Yeah, I completely agree. And I had a very, very similar experience prior to going carnivore that I was 250 pounds and I was pretty big and I was very, very sore. I'm an auto mechanic for a living. And, I kind of figured, okay, well, this is just part of getting a little bit older. You're going to be sore, things are going to hurt, whatever. You just got to deal with it. Once I lost, the 30, 40, 50 pounds, I felt fantastic. I'm like, wow, maybe my concept of aging is wrong. Maybe this isn't something that we have to live with. Um, Dr. Gabrielle Line is probably one of my favorite kind of health and fitness influencers. She oftentimes says that muscle is the organ of longevity. And I think that bears out in the data, as you were saying. There have been studies done, I believe, on elderly Korean women. The ones who had better grip strength, their overall mortality was less. So it's very, very important for people to kind of maintain that strength as they get older. My show's about liberty and health because I truly do believe that these two are intertwined, so much so that, if you're older and you have to depend on other people, you no longer are living a life full of, liberty and health. And that's incredibly important to me, and I'm sure it's very important to other people. So, it's good that people do their best to maintain muscle as they get older.
Yeah, and it brings up another important concept, which is exactly that you can be healthy as you age. This
Hmm.
concept that getting unhealthy as we age is inevitable, I think, is one of the biggest failings of our healthcare system these days.
Hmm.
There is no reason that we need to be unhealthy. There is no reason that the majority of people over 50 years old need to be on multiple medications,
Right.
which is the data that we see today. And certainly there is no reason that 88% of the adults in the United States need to be metabolically unhealthy, which is, again, the reality that we are in today. And you look at why this has come to be, and the bottom line is that the healthcare system has evolved in such a manner that it is not focused on keeping people healthy. It is only focused on taking care of sick people. And my message to people is that you need to take control of your health. You need to not be reliant on the healthcare system.
Mhm.
And you need to take charge, and you need to make the changes that are going to support your health, and ignore, quite frankly, what the food industry is telling you, what the government is telling you is the way to be healthy, and instead find your way, find what works for you to be healthy.
Yeah, I completely agree. And it is a shame that we've essentially been led astray and that the healthcare system is no longer a healthcare system. It's more of a disease management industry. Um, we should be focused on people's metabolic health because that is the driver of longevity. Same with, as I said earlier, muscle. Those two things will inevitably lead you to a life with with a longer health span. And this kind of carries into the conversation of what we've seen these last 2 years of COVID-19 is that people who are metabolically unwell, they do less well with COVID. My fiance and I both had it, and we're both relatively healthy people. And it was a breeze for us. It like wasn't even a thing. I felt a little under the weather for a couple days. I lost my taste and smell for a week, and I felt perfectly fine. My fiance, she felt a little rough for a couple days, and then she lost her smell for about a month. That was it. We, weren't in the hospital or anything like that. And that's not to say that there aren't young and healthy people who potentially see side effects from it because there are, but we don't base, the rules around that. Um, but it's a shame that we haven't heard these last 2 years to, hey, it's time to improve your metabolic health. It's time to just do some kind of exercise. And if you're not going to do either one of those, then you accept the risks that inevitably come with that.
Exactly. I think that COVID ultimately is a huge missed opportunity.
Hmm.
It was a very obvious, message to us that we, are so metabolically unhealthy that this disease was able
Hmm.
to, kind of have the effect that it did. The earliest data, those first days, the data that we had out of, China and Italy and New York was that
Hmm.
this was a disease that attacked the old and the metabolically unhealthy. And the reality is that old just means metabolically unhealthy,
Yeah,
because
actually.
it's more common for us in our current society to get metabolically unhealthy as we age. And if the message had been right from the beginning, let's fix our metabolic health, just stop eating, processed food and get
Hmm.
out and exercise a little more, we would be in a much better situation than we are today. And instead, we really got the exact opposite message. It was stay inside. They
Hmm.
closed down all the gyms, and it was, eat comfort food. And we saw, when the vaccines came out, the reward for getting your vaccine was, donuts and fast food. It's like we couldn't have gotten that more wrong if we tried, basically. It's the exact opposite of the advice that we should have been getting. And, we find ourselves in a situation, where we're still struggling with this 2 years later, when, as you said, as many others have said, and as I've been saying, is that if we just talked about metabolic health, we probably could have gotten out of this a lot sooner with a lot less harm done.
Absolutely. And, we're hearing a lot about vaccinations. And I had Brian Sanders from Food Lies on. And he put it to me this way,
Mm-hmm.
that we're basically outsourcing immunity to vaccinations. And I'm not against people getting vaccinated at all. I'm not. But if we want these vaccines to be maximally effective, then being metabolically well, there's even data on this to suggest that you're going to have a better antibody response. You will become more immune from the vaccines and from natural immunity if you're more metabolically well. And it really blows my mind that you've heard nothing about that. If we're supposed to take the vaccine and that's going to protect everybody, then why not say, hey, if you're metabolically well and vaccinated, you're going to be fine. But all
Yeah.
you hear is basically, oh, here, take the vaccine, wear a mask, stay away from people, and well, dietary stuff like that. Well, maybe that'll help, but it's almost like we're putting the cart before the horse.
No, exactly. Because even when you look at the data around, people getting breakthrough infections, people who have been vaccinated and
Hmm.
then get COVID, it's clear that if you're not metabolically healthy, you do worse with that.
Hmm.
It's no different than, the sort of first wave of infections before vaccination. So whether or not, you want to get vaccinated, I don't think should change at all. The
Hmm.
fact that getting metabolically healthy is going to, protect you from the complications of getting COVID. And, you kind of mentioned that, diet is mentioned as sort of a, kind of poo-pooed and mentioned on the side. The
Yeah.
reality is it doesn't even get mentioned.
Mm.
When you look at the conversation from the leaders in this, whether they be the political leaders or the health leaders, that are supposed to be guiding us through this pandemic, diet and improving your metabolic health does not get mentioned at all.
Mm.
It's not even paid lip service. So I think, again, that is probably the biggest missed opportunity, that we have. And the reality is that whenever we get through this pandemic, if we haven't done anything about our metabolic health, and the reality is that our metabolic health has gotten worse during this pandemic,
Hmm.
we're going to be just as susceptible to the next, virus or infectious disease that comes along. So, you know, ultimately, fixing our metabolic health is going to be the way out of this, and it's going to be what prevents us from having, recurring pandemics like this, because the true pandemic is
Hmm.
metabolic health. It
Hmm.
is what leads to the majority of death, disability, and suffering in our society these days. And ultimately, we're going to have to come to a reckoning with that.
Absolutely. I kind of always thought of it this way that COVID wasn't necessarily the killer. Granted, it did, kill a lot of people, but it was more of the pin that pricked the economic and health bubble. Um, I talk a lot about it on this channel and on my podcast, but this really exposed the underlying weakness of our health and our economy. Um, you know, Nobody was metabolically healthy. Like you said earlier, 88% of people fail to meet the basic measures of metabolic wellness. So when you have a disease or, a pandemic, people just are not ready to fight it off. And like you said, it was a complete and total missed opportunity. We've been going here for a little bit. Let's try to kind of wrap it up here and end on a little bit more of a positive note. How do you see, this all kind of changing, and how has your practice kind of changed over the years, and how are your patients kind of reacting, and what kind of success are they seeing?
Yeah. So, I now have basically two kind of parts of my professional career.
Mhm.
I continue to work as a heart surgeon and take care of the patients that need it. And I feel blessed to be able to offer that service to the people that need it when they need it. But I also have a telemedicine practice where I work with people to improve their metabolic health and to avoid the need for heart surgery. Because ultimately, what I recognize is that no matter how good a heart surgeon I am, no matter how good all the other heart surgeons out there are, we can never make the patient as good as if they didn't need the heart surgery in the first place. And I'm hopeful that our healthcare system is going to be able to refocus on keeping people healthy rather than just treating their disease. And I do see evidence of that. I go
Mhm.
to low carb medical meetings now, metabolic health focused medical meetings, and I see more and more physicians that are understanding this, involved in this, and talking out about it. Ultimately, my time and geography is limited, so I can't work with all the people that need it, and that's why I wrote the book, to get this message out to more and more people. I also offer, for instance, a group coaching program. It's called the Stronger Heart Society, and I can work with more people in the group coaching setting than I can in the one-on-one setting. So I personally am just trying to find as many ways as possible, going on podcasts like this, to get this message out to people that you need to take charge of your health. You need to focus on your metabolic health, and that's going to get you the outcomes that you're ultimately looking for.
Right. And I think that's a very, very powerful and great message to end it on. Everybody should take care of their health and take responsibility for what they got going on. Um, any other closing notes? Go ahead, plug your stuff.
Yeah, so the book is called Stay Off My Operating Table. It's available now on Amazon, on all the other major online platforms. It's in print, audiobook, and ebook formats. My website, ovadiahearthealth.com, OVADIA hearthealth.com, has all the information on working with me as a patient. I have a secondary site, strongerhearts.co, that is dedicated to that group coaching program that I was talking about. And on social media, I'm most active over on Twitter at iFixHearts. I can also be found on Instagram at Ovadia_heart_health.
Cool. Cool. All right. Well, I really appreciate you coming on. I'll get this out there and I'll share it on all my social media. I'm very excited to have people kind of hear about the work that you're doing, because I think it's great work. And I think a lot of people kind of need to hear the message of low carb health. Well, not even just low carb, but, get the hell off the operating table, man. We don't want you there. So,
Metabolic health.
yeah,
Thanks for having me on,
of
Kyle.
course. Thank you.